It happens to each of us. Maybe when we're 4, or 10, or 22. We ask the timeless question, what do I want to be when I grow up?
When I was 6 years old, I wanted to be an actress.
Oh, football player.
Ice cream man.
When I was a teenager, I wanted to be an engineer or a businessman.
An architect or an interior designer.
When I was 18, I wanted to be a journalist.
It wasn't until junior high when we were in biology lab dissecting these huge cow hearts that's what did it for me. I knew that the medical field was where I was going to be.
Whenever it was, at some point, you knew you wanted to be a doctor. And now, here you are on your way. But what kind of doctor?
I haven't decided the field I want to go into yet.
I know that I want to work with the adult population.
I didn't choose pediatrics because I would become frustrated by small babies that would cry and couldn't tell me what was wrong with them.
Out of the running is emergency medicine, radiology, pediatrics, OB-GYN.
Meet Arthi Nader. Like many first and second year med students, Arthi wanted insight into career options. In particular, she wanted to learn about the real, day-to-day routine of an internist. So she signed up for a preceptorship with the General Internal Medicine Statewide Preceptorship Program. Her preceptor, Dr. James Newman, an internist in Galveston.
Preceptorship is doing an apprenticeship. It's an apprenticeship. The student comes in and they follow you and work with you and learn what you have to know that's not in a book, just like they've taught doctors for the last 3,000 years.
A typical day. Dr. Newman briefs Arthi on their next patient.
So she's already had a chest x-ray. We'll look at the x-ray and then you talk to her and see what she has to say and then you come out and tell me what you think.
Okay.
But that's the situation. Okay?
They discuss the x-rays. Then Arthi is on her own with the patient.
I put them to work. I mean, they learn a lot from me, but I make sure they're an integral part of the office.
What brings you in today?
When I coughed up some phlegm that had some blood in it, and the last time that happened I had pneumonia, so I thought I needed an x-ray.
In addition to talking with the patient about her symptoms, Arthi checks her vital signs.
I was told that I needed to listen to the heart and lungs of every patient. So I did that, which is really good because it sort of helped train my ears.
After the exam, Arthi shares what she learned with Dr. Newman.
This morning she started spitting up blood.
After consulting, Arthi and Dr. Newman return to the woman who came to them for care.
All right, so we've been kind of
And so goes a patient visit, student and mentor working side by side, day in and day out for 1 month. Each patient, each circumstance is unique, but the process becomes routine, and new skills are learned.
The first day she didn't have a clue. Her first note was totally jumbled, and I edited all her notes. By the end of the month, she was writing notes that were better than the interns.
That's exactly how I was the first day I came to this preceptor, was completely clueless. And slowly you start learning the clinical side and how to interact and how to do everything clinically.
But I haven't learned how to do EKGs, to check blood levels, to do all the things that it's fun to do. It's much more fun than sitting and reading all day. My students always have fun, I guarantee that.
This is just one of the many student-doctor relationships formed every summer as part of the General Internal Medicine Statewide Preceptorship Program.
My name is Mandy Pinkerton. I'm a student physician working with Dr. Watkins. How are you feeling today?
I feel fine.
It's Chad. I'm a medical student. I'm working with Dr. Rush this month.
Well, I'm gonna go talk to Dr. Newman, okay? And hopefully we'll get you fixed up, okay?
Sounds good.
All right.
Good. Thank you, honey. Good luck to you.
In doctors' offices across Texas, students go beyond the textbook and come face-to-face with real people with real health concerns.
Apparently she had a panic potassium level 2.9.
The doctors press students to assess and make recommendations.
Well, she could have been a diuretic, I think.
What other things were we looking for? Symptoms that she might have?
It's pretty intimidating. I mean, you're wearing a white coat for the first time, and that evokes respect, and yet you don't know anything, and so you go into this room and these people are asking you questions and they want you to know how you're going to make them better.
Students learn that internists are generalists who care for patients ranging from adolescents to the elderly. Internists do not perform surgery, deliver babies, or care for children. Internists do care for adults with health conditions ranging from hypertension to diabetes, high cholesterol to kidney disease, and emphysema to the flu.
This experience of being in a private outpatient clinic gives the students an opportunity to see how all of the disciplines interact with each other in an outpatient setting.
Internists routinely work closely with subspecialists and other healthcare providers. These subspecialties become part of this interdisciplinary training.
And I spent an afternoon with a cardiologist, a rheumatologist, pulmonologist, radiologist, dermatologist, and I really had a wealth of opportunities to see the different subspecialties of internal medicine and how people worked and the different problems that they took care of every day.
Internal medicine is comprehensive, providing a continuum of care. Internists see a person from the initial office visit through diagnosis and treatment in a hospital if needed, and then back again for routine care.
It's just nice to see them again and just see what else you can do for them, or if what you just tried to do for them helped, or if it didn't.
Students are also exposed to the complexities of practice management.
I spent a whole day learning about the medical record, all the different codes that you have to use, the whole business aspect, and I spent a day with the business side.
Finally, students get to know their preceptor outside the office.
One day, when we were coming back from the clinic, his son called and was like, "Hey Dad, can I get a paintball gun? Because Jimmy got one down the street." He picked one up and I picked one up and the doc picked one up for himself, and we ended up playing paintball for the next 3-4 days after we'd get home from work, and then on the weekend too.
Preceptors become both friends and mentors to students, and they often form lasting relationships. What students learn during this month complements their medical school training and gives them an advantage in the classroom. Karen Zotter is on the faculty at the University of Texas Medical Branch.
And a lot of them will call on a patient, "Oh, I saw a patient like that this last summer with that problem," and it sort of gels it for them. It makes it a lot easier for them to remember things. Their confidence is increased, clearly their skills are increased, but they come back more able to see a patient without being afraid, to examine a patient with confidence, and then to organize and present a patient with confidence.
So for one career-shaping month, students live and breathe the life of an internist. It's time well spent.
When you come and you see patients and you talk to people, they talk to me just like they talk to Dr. Newman, like there was no difference, and that's sort of a cool feeling.
I chose to do the internal medicine preceptorship because I was having difficulty deciding between a career choice. I was debating between family medicine and internal medicine. And I felt that that was the best way to see exactly what an internal medicine physician did on a day-to-day basis.
If you're considering applying for this preceptorship, listen up.
It's a no-stress environment, high learning, exciting, and like I said earlier, it's 4 weeks, get paid, and you still have the rest of your summer. And when you come back for second year or third year, it's something that's going to give you a leg up on everyone else.
The sooner you can start seeing patients, I think the more that you can learn, the more that the book knowledge starts to tie in with what's really going on.
The most important thing I learned was that medicine is going to be a lifelong learning process, and that this is just the beginning.
Your tongue out for me. Say ah. Good.
For scores of first and second year medical school students, the General Internal Medicine statewide preceptorship program provides an opportunity to build a solid clinical skills foundation and helps students get a glimpse of the exciting field of internal medicine. It helps students make the transition from uncertainty to confidence. And it affirms life-changing decisions to that age-old question, what do I want to be when I grow up?